It's important to recognise the services that are delivered through capital estates and facilities because they are essentially the lifeblood of the organisation, which quite often go unnoticed but are vital to the delivery of day-to-day care in terms of producing the meals for all our service users, maintaining our hospital environments, cleaning the floors and walls, supporting the transport of our patients and service users, ensuring the light fittings work, the power comes to each building. Lots of those services, there is an enormous amount of work that goes on behind the scenes to make sure that those work effectively and first time at the point of use.
Healthcare chaplains as a profession are clinically facing. We spend most of our working day alongside service users and staff. And one of our many observations over the years is that the delivery of care doesn't reside exclusively with the clinicians, with the doctors and the nurses, the OTs and the allied health professionals. We observe and are very mindful that a lot of care is delivered also by estate and facilities staff. They are often engaging with service users and contributing quite significantly at times to the care that service users receive, and it's something we're very mindful of and something that we take with a sense of gratitude and appreciation.
Our estates, our domestic services aren't a separate bit of what we do, but they're absolutely integral to helping the people we serve keep well and then to recover well when they have a crisis. I don't think we say thank you enough. I just don't. Often, these are teams that you kind of may say hello to in the morning, but you don't think, well, what impact is this having? What service are these teams giving, not just to the other staff in the organisation, but most importantly to our service users, and just to say thank you. And I think that's important for all members of staff.
Estates and facilities are 24/7, 365 days a year. And a lot of what they do is not seen. I take into account when I spoke to one of the estates people and they said, look at this ward and you'll see that money's been spent, but half of it is hidden. It's hidden in the ceilings, hidden in the walls, hidden under the floors. And that's exactly like estates are as a team. You won't always see everybody that's involved, but it's really important to celebrate everybody that's involved with estates and facilities. And I want to thank them personally because I can see that the improvements in standards of care are just improving day by day.
Way back to many years ago when I was actually an inpatient, I don't think you realise, unless you can't leave that building, you don't realise how fundamental some of these things are to your care. So like your bedrooms, your curtains, your window doesn't open, and the issues and the intensity of those issues, especially in inpatient care, and how that is managed and how important it is. But then again, when I was on the ward, I didn't think of it, and then you come out and do the place inspections and you're thinking, right, so people do look at all this stuff and they realise how important it is. And I think it plays a massive part in delivery of care because the staff can't deliver care unless they're in a good environment.
I think the facilities and estates teams are really vital in the organisation because sometimes our corporate functions are called back office, but without all that support, whether it is in gardening, catering, whether it's in the switchboard, facilities and estates, or looking after our buildings or ensuring that we've got a clean environment, we wouldn't be able to provide great care. A massive thank you to our estates, facilities and capital teams for the fantastic work that they do. They're the backbone of the organisation and they help us to provide great care. So thank you very much for all your hard work, and it's great to celebrate you today.